This video is about understanding the link between high blood pressure, immune system, and cognitive health. The complex connection between high blood pressure, our immune system, and cognitive health is one essential component that deserves our attention. High blood pressure or hypertension is a common condition where the force of blood against the artery walls is consistently too high. It's often referred to as a silent killer because it rarely shows noticeable symptoms but can lead to severe health issues like heart disease and stroke if left untreated. Our immune system is our body's defense mechanism against harmful invaders such as viruses and bacteria. It comprises various cells, tissues, or organs working together to protect us. Surprisingly, there's fascinating link between high blood pressure and the immune system. Research has shown that inflammation plays a significant role in hypertension. When our blood vessels are constantly under strain due to high blood pressure, inflammation can occur. This in turn activates the immune system, resulting in a chain of events that may worsen the problem. To comprehend the link between high blood pressure and the immune system, it is essential to recognize the role of inflammation. Imagine inflammation as a fire within the body, a necessary response to injury or infection. However, when this fire becomes chronic, as is often the case with hypertension, it can lead to a range of health issues. In the context of high blood pressure, inflammation prompts the immune system to release substances that contribute to the narrowing of blood vessels and the stiffening of arterial walls. This creates a cycle where hypertension fosters inflammation, and inflammation in turn worsens hypertension. The brain is a highly sensitive organ that relies on a robust supply of oxygen and nutrients delivered through a healthy blood flow. Damage to blood vessels caused by inflammation brought on by hypertension may hamper the normal flow of blood to the brain. Over time, cognitive impairments result from the brain losing its supply of vital nutrients and oxygen due to reduced blood flow. Untreated high blood pressure has been related in studies to a higher chance of dementia, Alzheimer's disease, and cognitive decline. The brain condition known as Alzheimer's disease decline with time. It is defined by changes in the brain that result in protein deposits. Alzheimer's disease results in the eventual death of brain cells and shrinkage of the brain. The most common cause of dementia, which is characterized by a progressive loss of memory, thinking, behavioral, and social skill. A person's capacity to function is affected by these changes. This further emphasizes the need to address high blood pressure not only for cardiovascular health but also for maintaining cognitive function as we age. The good news is that there are steps you can take to break this cycle and protect your overall health. Managing high blood pressure involves lifestyle modifications and, in some cases, medications. Let's talk about a few possible ways to manage your blood pressure and strengthen your immune system. Adopt a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit sodium intake and avoid excessive consumption of processed foods and saturated fats. Engage in regular physical activity such as walking, jogging, or cycling. Exercise not only helps control blood pressure but also supports a healthy immune system. Chronic stress can contribute to hypertension. Practice stress reducing activities like meditation, deep breathing exercises, or yoga to keep stress levels in check. Limit alcohol intake, as excessive drinking can raise blood pressure. If you consume alcohol, do so in moderation. Monitor your blood pressure regularly, and if it is consistently high, consult a healthcare professionals. Early detection and management are crucial for preventing long-term complications. High blood pressure, often referred to as the silent killer, is a common health concern that affects millions of individuals worldwide. While its impact on physical health is well known, the connection between high blood pressure and cognitive function is an area that deserves our attention. High blood pressure occurs when the force of blood against the walls of the arteries is consistently too high. This condition often develops over a year and can lead to severe health issues such as heart disease, stroke, and kidney problems. Our circulatory system is closely related to our brain, which is the body's control center. For the brain to work as its best, the blood's continuously supply of nutrients and oxygen is necessary. An increase in blood pressure puts additional strain on the blood vessels, which may have an effect on the weak blood vessel network in the brain. Persistent high blood pressure has been linked to the development of white matter lesions in the brain. White matter acts as a communication network connecting different regions of the brain. Lesions in the area can disrupt the transmission of signals, potentially affecting thinking and decision-making processes. Research suggests that individuals with untreated high blood pressure may be at a higher risk of cognitive decline as they age. Conditions like dementia and Alzheimer's disease have been associated with hypertension, emphasizing the importance of managing blood pressure throughout one's life. Blood pressure can have a hidden impact in our ability to make decisions. Research has indicated that people with high blood pressure may exhibit changes in low they perceive risks and how they make decisions. This may have an impact on lifestyle and financial decisions. There is evidence suggesting a correlation between high blood pressure and mental health issues such as anxiety and depression. Skipping doses or discontinuing medication without consulting a healthcare professional can lead to uncontrolled hypertension. Chronic stress can contribute to elevated blood pressure. Practicing stress reducing techniques such as meditation, yoga, or deep breathing exercises can positively impact both blood pressure and cognitive functions. According to a recent study, immune cells in our brains may become unbalanced due to high blood pressure, which can cause issues with memory and cognition. The researchers suggest that if we can find a way to calm down these overactive immune cells in the brain, it might be helpful treatment. The National Institutes of Health backed this study, aiming to figure out how our immune system cells around the brain might be linked to thinking problems caused by long-term high blood pressure. Thanks for watching.